Welcome to the Depth Dialogues podcast.
where we explore how depth psychology is applied to tackle contemporary social issues.
I'm Kirk Schneider.
And I'm Tyler Gamlin.
Okay, welcome back, everyone. Today we are honored to welcome Dr. Usha Tummala-Narra to the Depth Dialogues podcast. Dr. Tummala-Narra is a clinical psychologist and professor of counseling, developmental, and educational psychology at Boston College. Her research and scholarship focus on immigration, trauma, race, and culturally informed psychoanalytic psychotherapy. Her publications include over 100 peer-reviewed articles and chapters in books. She's also in independent practice, working primarily with survivors of trauma from diverse sociocultural backgrounds. A fellow of the American Psychological Association, Dr. Tummala-Narra has served in various leadership roles in the APA, including the Board of Directors in APA Division 39, Society for Psychoanalysis and Psychoanalytic Psychology, and the APA Presidential Task Force on Immigration. Beyond her academic achievements, Dr. Tummala-Narra is an associate editor of the Psychoanalytic Dialogues and the Asian American Journal of Psychology. She's a member of the Holmes Commission on Racial Equality in American Psychoanalysis, initiated by the American Psychoanalytic Association, and member of the Board of Directors of the Psychotherapy Action Network, or PSYON. She's the author of Psychoanalytic Theory and Cultural Competence in Psychotherapy, along with several other publications by the American Psychological Association. Please join me in welcoming Dr. Usha Tummala-Narra to the Depth Dialogues podcast.
Usha, it's a great pleasure to have you here for our Depth Dialogue podcast and to really affirm and highlight the very important work that you're doing in the area of applying psychoanalytic principles to social issues, to the great problems of political and cultural divisiveness that we have now, ethnic divisiveness, and the general estrangement that so many of us are facing in our society today. So I'd like to begin this interview, this conversation with you, with a little bit of background as to what motivated you to pursue this area of psychoanalytic work. As you know, so many analysts are pretty much limited to their consulting rooms with people, and I'm very curious what prompted you to break out of that and to have a broader vision, a broader social vision in terms of the healing that you bring to people.
Thank you so much, Kirk, for having me today. I really appreciate the time with you, and I thank you for your contributions as well. In terms of what brought me to this work, and particularly to thinking about social issues and the social world that we live in, and its relevance to in-depth psychotherapies and psychoanalytic theory in particular. I'm an immigrant. I'm a child immigrant. I came when I was 7 years old to the United States and from India. And this was in the 1970s, the late 1970s. So it was a time when there was very little attention paid to the experience of immigrants, the internal experience of immigrants. And particularly as I grew up, I was in New York and New Jersey, and then later in Michigan. And when I was in my undergraduate training, and I decided to study psychology. And what I came to understand is that one of the things that drew me to psychology was to try to understand experiences that were largely unspoken in my community and my family. And these included issues like the cultural adjustment that my family and I were making and had been making. These were just sort of things that we were expected to do without much thought, with it sort of, and also without a sense of reflecting on what's been lost and how the loss might be impacting us as individuals, as families, as communities, and how we sort of position ourselves in the broader context of the United States. So those were becoming more apparent to me as I studied psychology in college. And then moving into my graduate training, one of the things that really stood out to me was how issues of race and culture in particular were not really discussed in the classroom back then. This was in the 1990s, and the literature in multicultural psychology was just emerging. And that literature spoke to me in many ways that were important. I was glad to see more visibility directed towards the experiences of racial minorities. And at the same time, the literature didn't quite capture the internal experience of what it meant to be an immigrant or what it felt like to be an Indian American. And so I started to listen. When I listened to my patients, it also became clear that what they were talking about was far more complex than what was reflected in our literature. And so I noticed this kind of gap in the literature, both within psychoanalysis and more broadly speaking in psychology, but also I started to think about the lack of access that so many racial minority communities and communities who are economically marginalized and marginalized based on other things like sexuality and disability and sometimes religion as well. And so I started to become interested in, well, how can an in-depth perspective, like a psychodynamic perspective, really integrate those kinds of experiences, and how can theory be modified and revised to reflect those perspectives and be more inclusive rather than sort of make this kind of demand to take theory that exists and sort of adopt it and apply it sometimes indiscriminately to people from all around the world, really. So those issues became really important to me.
So I'm just to follow up, I'm wondering how you conceive of the unconscious in terms of this challenge. It clearly you're perceiving it more broadly than the drive model of Freud, but perhaps even more broadly than the conventional focus on interpersonal attachment issues with the parents. I'm imagining that culture is very much involved in it, but why don't you share with us how you are seeing the unconscious and its application here?
Such an important question. What I started to wonder about, when I was in training was why, certain treatments were kind of relegated to people who are white, who had resources, and other treatments that were relegated to people of color, essentially. And those treatments were typically, the latter was really spoke to directive treatments that were problem-solving approaches versus the white people who could have the in-depth, work. And so there were these disparities there. And so it brings into question the very nature of how we conceptualize the unconscious, which goes to your question. Um, and so to me, I think we have this way of artificially dichotomizing and separating the psychic and the social. And for me, I very much see the social as shaping the psyche and vice versa. There's this mutuality, this bidirectional relationship. And certainly things that we experience on a day-to-day basis are embedded in a particular context and structure. Um, and that's and so most often I think we see inequality play itself out. We see it structurally, but we see it on a day-to-day basis more interpersonally, I would say. And people, we have those moments, those microaggressions, or those feelings of exclusion, or the power to say something or do something, or not have that power to do something or say something that's meaningful in a particular context. So I see how the structural inequalities that we have really play themselves out in the interpersonal, and then how it impacts us psychically. What does that mean about us and our sense of belonging, our sense of identity, and how powerful we feel or how helpless we might feel because of those realities that we're constantly navigating? And so I think about that a lot in terms of the experiences of all people, really, not specific to any particular group.
It seems like a lot of your work homes in on what Otto Rank calls the psychology of difference, how we deal with that which is different or other. And I mean, he viewed it as a very primal dimension of our anxieties, of our general anxieties. I'm wondering if you have more to say about this whole question of the primal nature of our fears of each other and our fears of the differences among each other, that they go very deep. I mean, he would say that they go right to the point of birth, right? The radical cleavage between relative unity and non-being to sudden abrupt being and pandemonium, and how we handle that at such an impressionable time. And that forms a kind of template for future anxiety about that which is other or different. But I'm just wondering if that enters in any way into your thinking, or if there are other similar streams.
Yeah, I'm so glad you brought his theorizing to the conversation, because there is, and I think about the trauma of birth, that there's this way in which we can use that metaphor and think about it in the context of our social context, our contemporary climate, really within the United States, but also globally, that it feels like anytime that there's the possibility of a birth of something, that could lead to something generative for some group of people, it becomes a threat to a separation from the old. And there's this constant type of tension between the old and the new, or what's perceived as old and what's perceived as new. And we can think about that even in the context of immigration, and xenophobia and racism, where that idea that these people are coming, these outsiders are coming in and taking what's ours. And I think it cuts right to that primal fear that somehow this way of life that has given us a sense of stability or security has been upended, So I think about Bronx work is really that offering that metaphor that really can be applied across various contexts.
And it does bring up the whole question of how are we met
Mm.
at very early stages of our development as well. And it seems
Mhm.
that our society is not very good at meeting ourselves early on, at least in ways that can help us to work with and through some of these primal fears of the other and of difference. So my sense is that that's a lot of what you're bringing in your work is helping people learn new ways to be met and internalize new ways of being met by you as therapist or analyst and within themselves in terms of internalization.
Yeah, I think the idea is for all of us to be willing to meet our own vulnerability and to recognize the vulnerability of opening up to something and someone who feels different,
Mm.
or is different in some way from us, like the other, whatever is conceptualized as the other. And we're all implicated in that. And I think that's important for us to understand, that all of us carry in different contexts, perhaps a particular marginalized experience or a privileged experience, depends on context. And yet at the same time, as a whole, we're still implicated in what's happening around us. And I think it's, we get into this situation where we, kind of again create these binaries of oppressor and oppressed. And it's, of course, far more complicated than that. Um, so my hope is that we can start to listen to each other differently, um, keeping in mind that we all have very complex histories, and it's not just sort of the ethnic group that I belong to or the religious group that I belong to or the gender that I identify with, but it's also how I experience those things based on my life history, based on my particular context. So it's really an opening up of subjectivity, of a person versus collapsing people into groups as if we're all homogeneous.
Mhm.
So it's something that we all share, but clearly from different angles and with different experiences of that primal upheaval, primal terror.
Yes.
Uh, I- Tyler, you have some reflections or
Yeah, I was wondering, what are some of the challenges that you face when trying to integrate these cultural narratives into the psychodynamic practice? Talking
Thank
about
you.
how you approach it, but what are some of the challenges? Because I can imagine that they may be plentiful.
Yeah, thank you, Tyler. I appreciate your question. I was thinking, I think a lot about how some of the challenges come up around um, interactions that we have with each other that sort of pose some kind of threat to us. And oftentimes that threat is based in a traumatic history of some type, that there has been something that has happened that gets triggered when there's a moment with a patient,
Mhm.
and there's sometimes a misunderstanding or um, a projection.
Mhm.
Uh, there's sometimes a way that we both retreat and move away from something that feels too difficult or
Mhm.
painful for both of us, perhaps, or one of us. So the challenges often come up in these moments where something gets triggered. Um, and it can also happen when I feel like I'm disappointing my patient,
Mhm.
or that the patient feels like they're disappointing me somehow, or that they can't ask me something because they're worried that they might offend me or hurt me, or that I'm worried about offending them. And I think these are reproductions of the faulty ways in which we interact as human beings as a whole outside of therapy, and they get reproduced. So if we think about that fear of being canceled, that fear of being,
Mm-hmm.
told that we just don't get anything, that we just don't understand. Um, I think those are the most vulnerable moments. And um, so there's a fear there of deepening intimacy that incurs us hurting each other at some point. And I think that's inevitable, or disappointing each other in some way. And so I think those are some of the most
Yeah.
challenging moments of doing this work, because trying to inquire about people's racial and cultural histories um, evokes a great deal of ambivalence.
Mhm. And I'm hearing that this can be both real and imagined
That's
fear.
right.
Even
That's right.
I may not have evidence that what I'm thinking would play out, but to me it feels as though it could. Yeah.
That's right. And even the imagined can be based on something real that's happened, right, in the
Hmm.
past, or as
Yeah.
something that has been observed, or
Yeah.
you're exposed to something that you watch in the news, or,
Hmm.
you know, you observe something happening to somebody else. So it might not be a direct experience, but it's that imagined, now the imagination is also coming from someplace.
Hmm. Hmm.
And whether it's something one has read, seen, heard of, um, and sometimes it's just the fear of the unknown.
Yeah. Yeah. Because we see this parallel in things that we try to avoid experiencing in ourselves with repressing and denying. So there's this equal um, approach with others where I don't want to experience that, so I will push them away or subscribe this past experience onto them, and what I think would be protecting myself from that same experience again. So
Mhm.
if a patient had a negative experience with a therapist when they shared something, they may say, well, that's probably going to happen again. So I'm going to avoid that, and I will shy away from the topic or avoid it if they're bringing it up.
Mhm. Yeah, and I think there is this kind of unforgiving part of ourselves too, where we think that we can't make any mistakes,
Mm.
that somehow that you know, if I make a mistake, that it is inducing some kind of traumatic, effect in the patient. And not
Hmm.
always,
Hmm.
really, not always. Sometimes it can be, but most often it's such a human
Yeah.
position,
Yeah.
that in fact, if we can engage with our mistakes honestly and try to work through them, both internally and with the patient, then I think it's much more honest and truthful, that it allows the for the patient to kind of make their mistakes as well. And, you know,
That ability to restore the rupture as well. Yeah.
exactly.
Yeah.
Exactly. There is, in fact, recently, there are two of my doctoral student mentees and I conducted a study that where we asked racial minority clients about their experiences of rupture and repair, and in their relationships with their therapists. And this was in psychodynamic psychotherapy. And most of our participants told us that it was just the ability for the therapist to be honest about what happened, and to be able to acknowledge and recognize and just keep going with it,
Hmm.
keep engaged, and not shy away from it. And that really helped. That helped deeply. And And many of them were coming from prior therapists who, and sometimes their current therapists, but mainly their previous therapies where they felt like they had to keep some part of themselves away from the therapist in order to have any benefits in the therapy. You know, it's almost like, well, I can get this from my therapist because I know they won't understand this part of me. So there was this, you know, compartmentalization that was a repetition, really, or reproduction of their lives outside of therapy. Um, and so, you know, that really stood out to me.
It keeps the issue hidden too. Yeah,
That's right.
compartmentalized. So would you say that honesty, it sounds like you're saying that honesty is a really important ingredient for therapists of a different ethnicity than their client as well. So, I mean, you know, here we are Caucasian, quote unquote, therapists. Um, I'm wondering if you have any more thoughts about how people from different ethnicities can relate in more intimate, supportive ways. Um, I I did see one of your videos where Mick Cooper asked this question as well. I thought it opened up some interesting avenues, which didn't have time to fill in too much. So here's a chance. But I guess I'm also curious about the question of regardless of one's ethnicity, when sort of when or how to enter into questions that or connections that have to do with uh, with ethnic, racial, or political issues.
Yeah.
Navigating that dynamic
Mhm.
across, yeah,
Yeah.
I would love to know that as well.
Yeah. You
Yeah.
know, it's like I do think that, you know, so much of our questions are guided by our theories, right? That if we so in my conceptualization, if I if I think that, well, this person's concerns might be shaped in some form, might be influenced by social contextual issues. So at the very beginning of meeting that person, I asked them to tell me about their life, uh, which includes their developmental history, of course, their presenting issues, their health history, all of those kinds of typical things, including perhaps a trauma history, if they feel comfortable sharing something about that. Um, but also about how and where they grew up, and the kinds of neighborhoods that they grew up, the schools that they went to. What was that experience like being in the school? Who else was there? If there's an immigration history, to learn about the pre-migration context. What, how did the family or how did this individual decide to leave that country? Was there any choice in leaving? Um, what do they remember about that, the life there? Oftentimes, what I find is that we're far more interested in knowing what happens after a person arrives to the United States or to the new country, and we ask far less about what life was like before.
Mhm.
And yet that so much of interpsychic life is, you know, steeped in that pre-migration context. And that pre-migration context becomes a point of reference for how things are experienced in the new country or the new context. So having a sense of that. So when I'm asking these kinds of questions, then I I'm already setting the stage for the patient to know that I'm curious about it. I'm interested, and I think it's not just my curiosity, but I actually think they're relevant to these pieces of information are relevant to their whole life and to the whole person. And so, and sometimes the patient wants to talk about it, and sometimes, the responses are very brief and they don't really say much, nor do they seem interested in going any further with it, which is completely fine. And I think that is where, I really want the client to take the lead, in wherever they want to take that. But I think just indicating to them that I see the importance and relevance of these issues. What I often find is that those patients who don't say a whole lot about that in the beginning, at some point later on, they know they can come back to it. And it's not just in the beginning, but I might ask, I might stop and a conversation for a moment and say, can I learn more about what you just said? And that might relate to a social contextual issue that I'm trying to get a better sense of. Because it's often the case that our clients or our patients are not making those connections themselves, because we're told in the larger world out there that things like discrimination is just stuff that you have to put up with. It doesn't relate to mental health, or it doesn't relate to depression or anxiety. And so when you come in with that mindset, the patient is not going to necessarily make those connections. Some do, but most don't, in fact.
So background and curiosity about background are really important aspects of what you bring. But I'm also wondering about the here and now. How do you work with the here and now between you and the patient or client? In other words, I guess your philosophy or approach to encountering the person, if you're sensing that there's something off or there's something that's maybe culturally relevant in your interaction, do you call attention to that in the here and now?
Yes.
How do you do that? Yeah.
I think it's very important because these are opportunities for uh, the client to really um, to work on something that feels precarious, often. So sometimes the person might be, we might be having a conversation, the client might stop. I can see some hesitation or feel some hesitation, or they stop talking about something that seems pretty meaningful to me. And then I may stop them and say, I notice we switched, to talking about something else at this point. Do you think something was going on there? Was there something there that I didn't quite get? Did something happen perhaps, or did I do something to move us into a different direction? And sometimes a client will say, I really didn't want to talk with you about it. It's very obvious.
They're picking up on, yeah.
Yes.
Yeah.
Yes. I mean, an example of that is one time I was asking about my client's caste and caste background, because that was relevant to her family's dynamics and some of the stress that the family endured in their life. And therefore, she endured some stress related to caste and casteism. And so as we were talking about it, she said, well, I just hate the whole thing. And, I wish we weren't talking about this. So there was this clear anxiety about talking about caste. And as we explored that more in the here and now, but not just in that session, but we came back to it at several points later, because it was a little too overwhelming, in the moment. And so when we came back to it gradually, she shared with me that it was hard to talk about caste with somebody who was from a lower caste than her, that she had suspected based on my last name But, so there were things that she could tell about caste that I couldn't because I have not been socialized to actually pick up on what caste people belong to based on one's last name. That was not my socialization. So we had a very different upbringing and context around caste. And so I couldn't pick up on certain things that she could. And so for me, I was left confused as to why aren't we talking about this? But I think if I hadn't asked her to kind of pause and ask her, can we do something with this? And her willingness to then try. And it happened over the course of many weeks. We wouldn't have gotten there.
It's so interesting about what you shared about what she felt uncomfortable about in particular, in terms of where you were in the cast, and not so much for her, I guess, in relation to. But yeah, you wouldn't have known that if you didn't. You would have possibly just said to yourself, well, I feel as though she doesn't want to go there. And then if you move past it, you wouldn't have that context of how can I maybe try again, or have more of a background to what the issue is here. That's fascinating. Yeah, that's not something that I was aware of either.
Yeah, it's such a dilemma too, because, there's always that dilemma of, well, am I going in the wrong direction here? Or am I pushing it too much? Is this imposing something? But at the same time, when you can sense that there's some hesitation there, it makes me wonder, what is that about?
Right, right. More than just there is hesitation.
Yes.
What is it? Yeah. When I think, as we know, certain approaches would not go the route that you did. They would just say, I'm sensing something here, I'm going to move on.
Yes.
Yeah.
And this also touches on what we might call the experiential dimension of the therapy. The question of pre-verbal kinesthetic aspects of what's going on, not just the verbal or oral. I'm wondering how much, if at all, do you bring attention to, let's say, what the person is sensing, feeling, imaging, or encouraging them to stay with an experience as distinct from continuing the verbal flow or interpretive flow.
That experiential piece, I think, is very important, that to ask about what's happening, in the moment, and can we just stay with this? Sometimes it feels intolerable for the person, but there's a willingness, I think, that develops over time. And time is essential for that to happen. I don't know how one could do this in a very brief period of time, right? But I think it's time in the relationship, and it's time that allows a relationship that allows the client to feel like they can trust me with this. That it is indeed so private and so intimate to be sharing how you're, like, what's happening inside your body to somebody else. I mean, that I think about the vulnerability about that, of that, and how difficult that is, particularly, right. And right. Whether it relates to trauma or whether it relates to just cultural norms, as and so many people that I've worked with saying, often telling me at the very beginning of our work together, like, I don't know what talking is going to do for me. And, I don't see how any of this stuff is actually going to help me, but I was, I was encouraged to come. So I'm here, but, and how many sessions is this going to be? Is this going to be done in, like, a month or two, or, and when you don't have those answers, that feel very concrete, that itself is asking the client to be vulnerable with you and to to bear this unknown process, which takes a lot of courage,
Yeah.
particularly when it feels so incongruent with one's cultural upbringing
Mhm.
and cultural norms, and you can't really tell your family that you're seeing a therapist, or that you don't want to talk about it with your friends. Maybe there's some stigma or some shame around it. So it's a very complex issue for many
Is
people.
this where an integrative psychodynamic approach may be helpful?
Yeah,
From a number of uh,
yeah.
possible ways of
hmm
relating.
I think that for me, I consider my approach quite integrative, in the sense that I'm always thinking about how does how does the research that we do, for example, in multicultural psychology, how is my understanding of feminist perspectives, how do all of those things actually inform how I'm listening to my client and what I'm understanding from my client? How am I hearing their words and interpreting that? So based on all of these different pools of knowledge that I have some access to. Um, and and it's interesting because when you bring up integrative, I think about one of my first psychoanalytic supervisors was Bert Karen at Michigan State. And I remember when I first met him for supervision, or in those days we interviewed, or they interviewed us, the supervisors, to see if we might be, I guess, a suitable supervisee. And so I remember he had agreed to supervise me um, on one condition, which was that I would read Freud and Rogers and Skinner. And so, and, uh,
Good
and of
balance.
course said, yes, I'll read everything. So anything you suggest. But, but it spoke to kind of this integrative spirit of really trying to understand. And I think in that particular supervision, really learning the importance of a humanistic um, sensibility in trying to, even though I'm conceptualizing from a psychoanalytic lens, I'm also really thinking about the spirit of humanism and humanistic psychology and existential issues in my work, in my being with a client, which I think has been incredibly important.
uh, Music to my heart.
Mhm.
But also, what I know of
Yeah.
Bertram Caron is that he brought that humanistic element to his work with psychotic patients as well.
He did. He did. I've never met anybody like him, in the sense that uh, in my graduate training, and it was this novel idea to think about a human relationship when
Mhm.
we're talking about psychosis, rather than what I had heard prior to that, which was far more based on symptoms and biological processes and medication treatments. But he really was a wonderful mentor in helping me to understand um, a human being, and uh, not only sort of the symptoms and trying to sort of rid one of symptoms. And that was probably one of the most important things I've learned about, people from the psychoanalytic and the humanistic existential perspectives.
Well, speaking of human beings, of humanity
Mhm.
writ large, we're clearly entering an era where we're more and more challenged by cultural and political estrangement, ethnic estrangement. Uh, I'm wondering, do you is your vision of this work and of social healing include some ideas about we can help to lift our society uh, uh, therapeutically, but let's say uh, to help people experience their lives with more vitality and more abilities to discover themselves and others rather than presume things and uh, try to force people into categories and have a kind of us them mentality, which seems increasingly prevalent. So I guess what I'm asking is, you have thoughts about making this work more accessible, more affordable, more communal. Uh,
Yeah.
some thoughts about general social healing from this standpoint.
Yeah, I think that one of the most important things that I have learned is to uh, really think about our assumptions about other people, even the ones, those around us who we disagree with vehemently, that um, and about the people that we do agree with on certain issues, that we make all kinds of assumptions about each other. And I think that there's a lot of inner work to do in terms of this problem of homogenizing groups of people and the good versus the bad. We are in this kind of paranoid schizoid position, of just, and so how do we then move towards more of, what we call a depressive position, of that there is, in fact, uh, a real the real differences that exist among us, in our life stories and our life experiences. But does that need to lead to a place of animosity, hostility, or can it be, can we move towards more understanding? But I do think there's a way in which, as psychologists, as therapists, we can move towards helping people to listen differently to each other. And that is a skill that, that we can offer, whether that's done one-on-one or in groups or in a classroom. We can certainly do more of that in training. And I've seen that in my classrooms where when I name that we're all scared to talk, to each other, and where that itself kind of lifts something up. When we can name the actual challenge of being together at this moment in our world, um, and I think that helps students, I know in my classroom, to say, okay, I'm going to take a risk to say something to the rest of you, and I'm going to ask you to listen to me without jumping to a judgment or without immediately adopting a defense mechanism, to a defensive strategy to kind of, you know, no longer listen carefully to me, So those have been very fruitful in my experience. I wish I knew how to, you know, expand that in a
Yeah,
more macro sense. But what I'm finding more recently is that these interpersonal moments are making a big difference in terms of how each of us feel in that moment, which is an antidote to what it feels like to be in the world much of the time right now. So it's one step. There are many more, of course, but in a way, it's like to ground us in our own humanism would be a good first step.
yeah. It feels like a critical step that you're taking with your students, and it also feels like you're bringing a kind of framework or ground rules to the conversations that help people feel more safe and more permission to be honest with each other or to have a more discovery orientation rather than presumption. Yeah. And of course,
It's
that's a lot of what we're trying to promote
Mhm,
uh, with the core of depth healers.
mhm. And
More,
I think there's a real hunger for that. I think people want very much to connect and understand for the most part. I think there is a minority of people, a smaller group that is louder, that doesn't want that,
yes,
but I think the majority of us want that kind of connection and miss that kind of connection with each other.
yes.
As a follow-up to Kirk's question, I'm wondering if you can talk about how you see culturally informed psychoanalytic approaches contributing to social healing, particularly in these polarized and divided communities. We were talking before we started recording today about what is kind of our new norm now for the next 4 years, and what do you see as some specific things and in the psychoanalytic space that can contribute to some of that social healing? I know that's kind of what Kirk was asking, but more specifically, because I could, I view therapy as a type of culture. There's norms,
Mhm.
and there's a place that we're orienting from. And so when we sit in the room across from our client, there's a lot of different things that we're learning about each other. How does therapy work? How are you in conjunction to your family? Is your where you immigrated from an important part of your background, or is it just where you were born and you consider yourself an American? So there's so many levels of what we're trying to learn about each other and what is normal and customary. And as Kirk said, one of the things that we really focus on is bringing these ideas beyond the consulting room and applying them, because there's so much that we know, this rich body of literature from depth psychology in particular, and how can that benefit our
Mhm.
community beyond what we know already, which is this is how this can be applied with one individual in a long-term therapeutic setting where you've built rapport and you have ruptures.
Mhm.
I know that's a lot.
Mhm. No, I think it's an excellent question because I do feel like there's an imperative that we have to do something with the knowledge that we have been learning, right? And
Yeah.
whether it's theory or research or clinical practice, one of the things that I think, that I have found helpful is to speak to different communities
Mhm.
around and share this knowledge in some form or another. Like, for
Mhm.
example, I last year, one of the things that I was involved with was um, a workshop with a group of young Indian American high school students, young kids who um, were interested in just learning about um, the psychology of immigration as it relates to them and
Mhm.
their experiences. So one of the things I talked about with them and I talk with the parents as well, is this kind of generational differences within our communities, and and talk with them about the role of racism in mental life and what it does to us. Um, and not only sort of the research that indicates the detrimental effects of racism on mental health outcomes, but in addition to that, what's it doing to us internally and interpersonally? And this is the part of the in-depth psychology work that I think sits alongside the research that I do, is to kind of say, well, we have these findings, but what does it then mean for us
Mhm.
on a day-to-day basis? How do we behave differently when we're in one context versus another? And what do you think is happening, maybe even unconsciously,
Mhm.
automatically
Mhm.
for us? And what is the loss that takes place? What's the loss that's incurred in that process? And what do we do about it? How do we support each other? How do you connect with each other and with the people that care about you in your life to be able to share those experiences, that you're not isolated with those experiences? So those kinds of dialogues within this particular community was really interesting for me, because I do think there are ways that we can reach out to the communities that we have some connection to, and not just sort of keep this knowledge, in our clinical practices or our colleagues or our academic settings, but really try to talk to people about the things that we have understood or have come to understand, that it's not just sort of in a journal somewhere, which I love journals, but, in addition to that, who are we actually having conversations with?
Yeah.
And these students and their parents wanted more. They wanted more of this real dialogue, because they wanted to stop just talking about the stuff that was going well to other people in social settings, but they wanted more realness in their relationships with people that they interacted with every day. They wanted more authenticity. They wanted more honesty. And that is therapeutic, so, and you don't need to go see a therapist for that to happen.
Right. Yeah. That's what, thank you so much for that. What it comes down to, what I've noticed when I ask this question and when Kirk and I have addressed this, is that it always comes back to this idea of how we're relating to others. And you mentioned this at the beginning of the podcast, was it's not about changing someone's mind and trying to disagree, but it giving space for different ideas and being respectful. And the goals of the core of depth healers is this emotionally restorative relationships where people feel seen and heard and get at the root of the problem. And that there's this theme and this thread that I'm noticing when we talk about taking this out of the consulting room. One of the big takeaways is, how are we approaching others when we disagree?
Right. And how do people access information, and talk about it with each other, that it's not just sort of, I mean, this is an interesting bind that we're in today, where we have so much access to information, but people are listening to different things and they're watching different things.
Yeah. What do I listen to? Yeah.
Right. And it becomes a very isolating experience. Actually, you feel like you're connecting to something, but you're never really talking about it with anybody else. And so there's this strange paradox of the information age, that we have so much information, but it largely sits inside ourselves. And I think when we don't have that interpersonal piece, this is what sort of keeps us in our silos. And it doesn't transform the way we feel and the way we think.
And to be able to disagree and not be rejected. Right?
Yes. Right.
Well, we have huge issues on our table here, not least of which is how to create a new normal, so to speak.
Yeah.
Another new normal.
Yes.
Hopefully. Well, I want to thank you so much for giving of your time and, the treasures of your experience and your knowledge
Thank you.
to this forum.
Thank you, Kirk, and thank you, Tyler. I so appreciate the time with both of you.
Thank you very much. I appreciate you, and we'll be in touch.
Thank you.
Keep it going.